Good morning, Stephanie. How are you?
Good morning. I'm well. How are you?
Good. We are recording the meeting. We have it set to automatically record when we start it. Are you seeing the slides, the informative pre-meeting slides?
Yes, I am. Thank you.
Perfect. Okay, good. We'll just let those keep looping. There's the agenda, of course. And yeah, we'll just keep this going until we have a consensus of people that have shown up, and then I will stop it, and then I'll hand the time over to you for a call to order.
Perfect. Thank you.
All right. Well, I'm going to go ahead and mute myself so I don't get um, any unexpected recordings taking place. So.
Sounds good. Thanks. See you soon. Good morning, everyone. This is Stephanie Richmond, the chairperson for the Medical Cannabis Advisory Board. I see that several from the Department of Health have joined us and understand that this meeting is currently being recorded. I also see that there is one other cannabis board member present on this call. Nice to see you again, Dominic.
Great to see you, Stephanie.
Can wait a little bit longer to see if others can join so that we could establish quorum. And if we don't have quorum, we can still get some updates from the Department of Health. All right, it does not look like we quite have quorum, but I think we should go ahead and proceed for those of us that are present. This hearing of the New Mexico Department of Health Medical Cannabis Advisory Board will now come to order. I welcome you to the public hearing where the Medical Cannabis Advisory Board will approve the previous meeting minutes and receive updates from the medical cannabis program. We will discuss the status of the previously approved diagnosis of female orgasmic difficulty disorder, and no new petitions have been submitted for our review. We will also hear any comments from the public and schedule our next 2025 meeting. Pursuant to notice, this matter is being heard this 21st day of November 2025 via a web-based platform and is being recorded. The time is 9:07 and I'm Stephanie Richmond, the chairperson for the Medical Cannabis Advisory Board. The New Mexico Department of Health Assistant General Counsel Chris Woodward will be advising the department during this proceeding. The proceeding is being held in accordance with the Linen Aaron Compassionate Use Act, Sections 26-2B-1 through 26-2B-7 NMSA 1978 and regulations at NMAC Title 7, Chapter 34, Part 2. If members of the audience have not already registered for this event, please register online so that your attendance may be noted and included with the advisory board submissions to the Secretary of Health. I'd like to thank my fellow board members for joining today's meeting, and it's a pleasure to work with this board. At this time, I'd like to introduce each Medical Cannabis Advisory Board member and take a roll call in alphabetical order. After my introduction, please share your interest in the Medical Cannabis Advisory Board. We can always circle back to include more as others have a chance to join. Correct. I don't see Eileen Barrett on the call. Can I have confirmation about that from the department?
I do not see Eileen just yet.
Okay. I also do not see Mordecai Bronner. Okay. I do see Bettina Ortiz Kose. Thank you for joining us. Can you please share with us your interest in participating on the Medical Cannabis Advisory Board?
There we go. Oh, hi. Sorry about that. I am probably one of the worst technical people around. I just got interested in this a few years ago. I started working with Compassionate Hearts in Aztec, New Mexico, and now I'm actually working on my doctorate in nursing at NAU, and my topic is medical cannabis. So it's kind of just been something that I've been very passionate about. And I actually will be starting to help our fellow patients up in this Four Corners region, because we don't have hardly anyone, I think, doing this up here. And so that's kind of how I got interested, and at the recommendation of Dr. French as well. So
excellent.
Thanks.
Thank you for joining. Nice to see you today.
Thank you.
All right. Rachel Goodman, I think, is absent or not yet joined. Cindy Griebler.
I'm a family practice doctor. I've been recommending cannabis for patients since it was legalized medically. It has definitely been something that has been helpful, especially for my chronic pain patients and cancer patients. And I think that having more medical people involved makes this a much better process so that patients can get good information.
Thank you for joining us today, Cindy. Sabrina Johnson.
Okay, can everyone hear me? All right, so I've been a PA in the state of New Mexico, primarily underserved areas for probably about 15 years. So lots of issues that we all deal with within our state. Lack of medications, lack of being able to get PT or anything that requires lots of copays or lots of travel. So it leads us to have to use other things to help our patients with chronic pain or numerous comorbidities. And cannabis, I have been an advocate for since it became legal as well, and have been able to downsize medication list by adding cannabis. And it's been a wonderful thing. So I'm a advocate for patients so that it is medical and we can help them and make this a very safe, useful medication and utility for numerous issues.
Excellent. Thank you for joining us today, Sabrina. I see that Alan was able to log on just in time. We're doing roll call. If you're able to confirm that you're present and explain why you're interested in participating on the Medical Cannabis Advisory Board.
Okay, Alan Plymell here, Deming Desert, and I'm sort of semi-retired. I only work 2 days a week. So after all these years, I thought it would be nice to donate time and service to a worthy cause. And I think that we've done some good work over the last few years, and ready to move forward with the same.
Excellent. Thank you very much, Alan. It's nice to see you. My name's Stephanie Richmond. I am a PA that's been practicing in New Mexico for about 20 years and have been participating with the Medical Cannabis Advisory Board for the past several years. I do believe strongly in supporting patient care through the use of medical cannabis on this board. So thank you very much for joining. And then the last board member that I see present is Tracy White.
Good morning, everybody. I'm Tracy White. I'm a pharmacist clinician practicing in oncology and palliative care. I became interested in cannabis in my years of work in hospice. I did that for about 10 years, and my work continues here at the Cancer Center, providing pain and symptom management for our patients. So cannabis has kind of been in the toolkit for a while, and I just want to improve, again, patient access and education about its medical uses.
Excellent. Thank you. Nice to see you, Tracy. All right, so there are 6 of 9 advisory board members present, and therefore we have established quorum. We will now proceed with the meeting agenda. I motion to approve the minutes of our last meeting on October 7, 2024 from documentation that was provided to the board prior to this meeting, and the meeting was recorded and may be viewed on the Medical Cannabis Program webpage. Is there a second for the approval of these minutes?
I second that.
I would second it.
Perfect. I hear 2 seconds from Alan and
Cindy.
sorry, I missed the other.
Oh,
Perfect.
Cindy Griebler.
Thank you, Cindy and Alan, both seconding, and the minutes have been approved. At this time, I would like to invite the Medical Cannabis Program to update us regarding their activity and progress.
Okay, great. Thank you, Stephanie. And before I jump into the updates, I did want to acknowledge that we do have a couple new members on our medical cannabis team, and also some position changes. Why don't we start? Brenda, would you like to inform the board with regards to your new role?
Yes, thank you. Good morning, everybody. Brenda Martinez. I am now the Deputy Director for the Center for Medical Cannabis.
Great, thank you. And then Rosalie?
Hi, good morning, everyone. My name is Rosalie Nava, and I'm joining the team as a health educator manager. And my background is in public health, and I'm a licensed social worker.
Great. And of course, Rosalie will be directing Diego, who is not here with us today. And I think you all maybe met Carmen, but Carmen, why don't you go ahead and reintroduce yourself to the board that's here today?
Hello, everybody. I'm Carmen Batista. I'm a health educator. I've been with the program since 2019.
All right. Great. And in the near future, we hope to see more health educators as well. And we're really fortunate that we have the ability to switch to education now that we've got the portal up and running. All right, so I'm going to go ahead and start a little slideshow here with regards to our updates. All right, and here we go. We're going to talk a little bit about news from the legislative session, medical psilocybin program. We're going to have Carmen introduce the Cannabis Learning Lounge and educational webinar. And again, this is a webinar not just for dispensaries, but actually for everyone. So we're anxious, excited to share that. But I'll go ahead and start here and talk a little bit about the legislative session. And again, there were numerous cannabis bills. Hopefully some of you maybe had the opportunity to follow that. The website's quite easy to follow. You can just type in a specific word, and every bill that has related to that word will come come up. And again, cannabis, there were numerous, but there's really 4 here that I thought were most interesting and perhaps most relevant to our conversations here. One was House Bill 10, and it was called the RLD Cannabis Enforcement. And what this really was for is it gave RLD that oversight to have essentially law enforcement duties or law enforcement abilities when they go and evaluate a dispensary or evaluate a production area. And this is something that they were lacking. And I think that this additional enforcement power will enable them to provide much better oversight going forward. This bill was signed by the governor on April 8th. And so again, expect RLD to enforce their oversight with more powers. Next, House Bill 230. This was a bill that was titled Cannabis Testing of Certain Employees. And essentially what it was trying to establish some criteria by which individuals in a safety-sensitive position may or may not be able to utilize cannabis. And it talked a little bit about, when is testing appropriate? When is it not appropriate? It did not pass. And so we'll see what happens with this bill. But again, this is similar to, maybe you heard, I think it was Rio Rancho, where there was a fire department that sort of made an arrangement there with the city council there with regards to their use of cannabis. This was taking a similar approach, and we'll just have to see if this makes it on the docket, maybe in the special session or even next year. And again, one item there was it was going to task DOH with creating some of these criteria or guidelines with regards to testing for those individuals that are in safety-sensitive positions. So we'll see what comes of that. Next was House Bill 346. This was a hemp products and synthetic cannabinoid bill, but this was actually an attempt to ban them in certain circumstances. There was a lot of issue with regards to what is a producer of hemp products versus a seller. But again, it passed both the House and Senate, but I could not find anywhere where this was signed. So I do not believe House Bill 346 was passed. We'll have to see if this does make its way onto the docket again. Again, this is banning those synthetic cannabinoids and those Delta-8, Delta-10 hemp products that can be problematic. So again, this is a theme that I think we've seen in other countries, other states, as well as on the national stage as well with regards to banning hemp products. And then next is House Bill, forgot an L there, 527. This was insurance coverages for medical cannabis costs. It did not pass, but that was so interesting here is that this was essentially would make it requisite for insurers to cover some of the costs of medical cannabis. And so rather dramatic issue there, but again, it did not pass. But we'll see, on the both state stage, but also the national stage, if insurers are going to start being required to cover some of the costs for medical cannabis therapies for patients. All right, so next I'm going to pass this over to Dominic, talk a little bit about medical psilocybin.
Good morning, everybody. I hope everybody is doing well. As you may also have heard during the legislative session, there was a lot of interest and a lot of testimony with regard to the advancement of a medical psilocybin use act, and that was Senate Bill 219. It did pass through both chambers of the legislature and was signed by the governor on April 7th, 2025. It did have a lot of bipartisan support, so there was a lot of understanding that this was that medical psilocybin is something that could help a lot of patients. Especially noted during this was the impact that it may have on the care for many of our veterans who suffer from PTSD and from treatment-resistant depression. The 2 other conditions are also, and by the way, that's not just for veterans, but it was highlighted quite a bit during testimony that this would be something beneficial or potentially beneficial for those veterans. And there were 2 other conditions that were also approved, which were substance use disorder and end-of-life care, especially regarding anxiety and depression at end of life. And so the program by statute has been now assigned to the Department of Health, and the Center for Medical Cannabis has been asked to develop and begin implementation on this. So we will have a change in the name of our center down the road a little bit, but first we want to try to get things moving forward with the program itself. And so over the next few months, what we'll be doing is we'll be having quite a few public hearings, public meetings, so that we can actually hear from the advocates, from clinicians, from other individuals who are interested in the program. And we will also be working on rules, regulations, and policies, protocols, and trying to get all of that established. Now, we do have the luxury that the legislature did agree that we needed time to be able to develop this, to ensure that the research is being studied, and to really develop this in a well thought out and deliberate way. So the program is set that it must be implemented by December 31st, 2027. So that essentially gives us 2.5 years to be able to go through this process. And as many of you know, going through the rulemaking process and creating protocol and guidelines takes quite a while, especially because we don't want to do this in a way where we just suddenly create protocols or rules and regulations and put them out there. We want to get feedback. And so we'll be working on drafting those and then having, as well as holding public meetings. And then after they're drafted, then holding additional meetings to get that feedback to ensure that we're doing this in the most effective, safe, and therapeutic way possible. So it does also involve a new advisory board for medical psilocybin. And so we will also be assembling that coming up here shortly. We are working on establishing a web page on the Department of Health site that will be able to provide information, including that contact information. But if any of you here actually have anyone who may be interested, they are welcome to reach out to me, and I will go ahead and provide them with additional information. And if it's somebody who's interested in being on our advisory board, then what we will also do is I will add them to the list that once we have all of the requirements, many of which you all are familiar with, having gone through the process yourself with being appointed to an advisory board, once we have all of that established and vetted through the governor's office and through the Secretary of Health, we will go ahead and have some of that information also up on our webpage. So for right now, we're really in the planning and development side of it. But this is a really exciting program to us as well, because it also includes two other factors that we really did not have when we started in the medical cannabis program. And one of those is that the legislature, while it has not yet been funded, established a research fund so that we can actually help with regard to research about medical cannabis and conditions, and to see what the potential effectiveness may be, if there are any issues with regard to side effects and other potential problems, as well as looking at the benefits. The other fund that was created and has not yet actually had funds put into it is that the legislature was very clear that they wanted to ensure that this would be something that would be available to anyone who really needed anybody who really needed psilocybin as a potential therapeutic benefit. And so they established an equity fund. And so what we'll also be doing as part of our development is looking at what areas are underserved, what populations are potentially underserved, affordability issues, and really looking at this to try to make sure that anybody who would need to access the program will be able to access it through either their own means or through assistance through the state. Now, of course, this does mean that, we have to develop the rules behind what that access actually means. And so that will be a part, especially a large part of the public hearings and the public meetings that we will be doing, because we definitely want to hear from people about what potential barriers they may face and try to solve and determine ways to help either dissolve those barriers or to work with them. So that's really what's happening at this point, and we're very excited about it. But this is just the very beginning stages. So other than this, we don't really have a whole lot of information, but we are planning on getting things moving forward fairly quickly with regard to the advisory board and starting to set up the public meetings. Which, by the way, the public meetings will be in various places throughout the state. I think we've settled on that it'll be either 6 or 7 different locations. And while we will, of course, include the major population centers, we also will be trying to do them in some of the smaller population hubs, such as Farmington, Roswell, and things like that. So, yeah, that's really all that I have at the moment, but we're very excited and looking forward to this. And it really is a very exciting aspect for the development of what we're looking at with regard to using natural products and for treatment for individuals. So with that, I'll turn it back on over to Dr. French.
All right, thank you, Dominic. Carmen.
Well, hello, everybody. I'm going to introduce our Learning Lounge. We have created a page with educational materials about medical cannabis and related topics. If you cannot find the information on a specific topic of interest, here we have let everybody know that they can reach out to us. We can create that information. I am posting the website where our main page is, where the link is available. It's free educational material for anybody that wants to print it, download it, and post it in their practice dispensaries. We have them also available in Spanish if you have Spanish speaking patients as well. Our next new site that we have is also for requesting a presentation and or educational webinars. So this is also on our main page for the Center for Medical Cannabis. We have added this tool available for anybody that wants to request us to be there at a location for a conference, provide any form of training to staff. We are working on other resources for patients, but this is new tools that we are providing for everybody to have access to.
All right, thank you, Carmen. And again, if any of you have patients or work with dispensaries, these are definitely great resources for them. Again, if you share a lot with the patient, but they have more and more questions, you can definitely direct them to the Cannabis Learning Lounge. They might find the answer there. And again, we have come across a lot of dispensaries that need a little bit of updating with regards to, most importantly, some of our reciprocal participants in the program. So yeah, so great. With that being said, Stephanie, I'll turn the time back to you.
Perfect. Thank you very much for those updates regarding outcomes of the legislative session, what to expect moving forward with the psilocybin program. I'll keep an eye out on that website. Thank you very much for those updates. And I do appreciate the information regarding the Learning Lounge. That looks like a great resource. So thank you very much for sharing all that information. I'd like to ask if any of the fellow board members have any questions for the Department of Health. It looks like T asked in the chat if we could have links for the education sent to us in an email. So it sounds like we'll be getting that sent out to us. So, but an excellent resource. So thank you very much. I appreciate that.
So do we know what the guidelines will be for the individuals who will be on the psilocybin board? Like what the range of providers? I'm assuming there's going to be therapists that are also on that board.
Great question, Cindy. Just to let you know, there are 5 of the positions are outlined in statute, and they include individuals such as there has to be a member or a representative from the healthcare authority. There has to be somebody who is a behavioral health professional. There needs to be an individual who is a veteran, and there's a couple of others that are outlined. And then, but there's a total of 9 positions. So the other 4 positions will really be at the discretion of the secretary to determine. But we've already discussed that aspect to ensure that there are going to be a combination of medical and behavioral health professionals as well as advocates. So there's already been that discussion. But as to the exact makeup, in part, it's going to depend on who applies. And we'll be having that process, like I said, over the next couple of months. But we will be posting some additional information to our website. And I would provide you with the website, but it hasn't actually been created yet since this is so brand new. So we'll have that soon. And what we'll make sure is when we do have that created, we'll send out an email to all of you that includes that website. But you're also welcome to go to our program, our current medical cannabis program, because it will be linked there as soon as it's created. But that's a great question, and thank you for asking.
Nice, thank you. Excellent. And then I also see that Eileen Barrett has joined us. Thank you very much for joining, Eileen, to get you updated. We have approved minutes from our previous meeting and received some updates from the Department of Health. Now I would like the record to reflect that Eileen is present as a fellow board member. So we have 7 of 9 board members on the meeting. Thank you. At this point, I'd like to discuss our previous petition that was approved for addition as a qualifying diagnosis at our last meeting in October 2024. The petition was for the addition of the female orgasmic difficulty or disorder as a qualifying diagnosis. After a majority approved this diagnosis, I deferred the write-up for the final recommendations of the petition to the members that voted in favor. The board members that voted in favor included T. Kosei, Rachel Goodman, Cindy Griebler, Sabrina Johnson, Alan Plymel, and Tracy White. Eileen Barrett and myself, Stephanie Richmond, voted to not approve the diagnosis, and Mordecai Bronner was absent. At this time, I motion to have an open floor discussion to address the status of the final recommendations of the petition. Is there a second?
A second.
Thank you, Tracy. Seconds. Excellent. I would like to hear back from the fellow board members about the status of the final recommendations for this petition. Was there any discussion in between the 2 meetings regarding finalizing these recommendations so that they could be submitted to the Secretary of Health?
I just like to say that I totally apologize for not getting this information in. I had some family issues and got a little distracted. But if there hasn't been anything formalized, I would like to organize that with the other members who voted yes, to maybe figure out a time to get together so we can formalize that. I did not see that information.
Okay, great. Yes, T.
Same here. Unfortunately, life takes a little bit of a gander with things. So I'll be happy to help you out, Cindy, and we can also see what we can develop as far as writing information down and having it submitted.
Perfect. I think that the Department of Health had also created a SharePoint, so that could also be manner for some kind of asynchronous work on the petition. I believe on that SharePoint site that there were also some previous recommendations that had been submitted to the Secretary of Health for examples of like formatting and information that has historically been included. So perhaps that would be something that we could get an update for prior to our next meeting so that this information could be submitted to the Secretary of Health. We do have a new Secretary of Health as well.
So anybody who's interested in like getting together, I would like to just put that out there so we can formalize this.
I did put the link to your SharePoint site in the chat.
Okay, thank you very much, Kathy.
Yeah, and on that SharePoint site, you should have access to all of the submitted documents that were included in the original petition, as well as the documents that were discussed in the previous board meeting back in April of last year, or pardon me, May of last year as well. And then Eileen, are you able to mute or unmute yourself now? I know that there was a little issue there and I hadn't heard from you. Would you like me to unmute you, or because you're muted right now? Oh, you're good. Okay. Or all right. So I guess we're good to continue. But yeah, please use those resources there. And if you do need that information as well, it's posted on our website. If you go to the meeting time and date, then the petition information is all there as well. And if you have any problems accessing that information, you can also email me and I can help facilitate that.
Excellent.
Her
Thank
thumbs
you.
up could have been that she was answering you to unmute her, Gary. Eileen, if that's what you meant, thumbs up again. Yeah, unmute her, Gary. You're muted now, Gary.
Eileen, you have rights as a presenter. You should be able to unmute yourself. No? Perhaps
I'm seeing her identified as a meeting guest.
not as a presenter.
Perhaps that's because I'm a guest. I don't know.
Yeah, well, she just texted me and she doesn't have anything to add at this time.
Okay.
And Eileen, she's going to hop out and rejoin and we'll see if that resets it. And
Okay.
Eileen, you can always text me as well and I can read those into the record here if need be. I apologize that we can't unmute you.
Isn't technology great?
I know, for sure. Excellent. Thank you for all of the efforts to support it, though. All right. Well, when Dr. Barrett is able to join, we can reach out again and see if she has anything that she would like to add. Moving forward with the, okay, well, just to verify, thank you all for the fellow board members that have agreed to participate in writing up of the final recommendations for submission to the Department of Health. Maybe that can be done prior to our next meeting so that we can give some updates regarding that when we next convene later this fall. All right, for public comment, individuals who have pre-registered for the meeting and have requested to make a public comment will be able to comment first and should limit their speaking time to 3 minutes. If you have not previously requested to make a public comment, please click on the raised hand icon on your computer or dial *5 if you're calling in by phone. I ask for assistance from the Medical Cannabis Department with calling on the speakers and monitoring for time if we have any interested in making a public comment. For those of you that are unable to make a public comment during this meeting, the period to do so will be open for 48 hours after the meeting and can be sent to medical.cannabis@state.nm.us. Right, thank you. And we look forward to hearing any public comments if the department can help to facilitate that.
Okay. Well, as I don't see any attendees from the public, Stephanie, there's no public comment at this time, it appears. And I'm still working with Eileen. Eileen, if you want to text anything you'd like to share, since I cannot get this mute, everything's okay? All right. We will figure this out before next time. But again, thanks for your patience. So yes, Stephanie, there's no public comment at this time. If you just want to proceed with establishing a meeting date in the future.
Perfect, thank you. All right, so thank you very much for being able to join us today, and I appreciate all that you do for your patients and with working with medical cannabis to support this at this time. I'd like to propose that members of the board discuss our next dates for our follow-up meeting sometime in October, November 2025. I motion to have an open floor discussion at this time to discuss meeting dates. Is there a second?
I second.
Excellent. Thank you, Sabrina. Sabrina, second. So thank you. What do you guys think about a follow-up meeting? I was looking at some dates. What about October? These are all Mondays. 20th, the 27th, or November 3rd. All of the dates would be at 9 o'clock. Or all of the times would be at 9 o'clock on those dates.
October, what was the date?
20th or 27 or November 3.
I won't be able to do November 3rd, but the other 2 dates look okay.
Okay, the 27th or the 3rd do work best for Eileen.
All right, so 27th seems like
And
good one for me.
And later in the day would be also preferable. Just adding
I'm
that.
good for either.
Okay, so it sounds like the preference is to have this on October 27. And then time is up for conversation. Also, historically, this is something that we've held in the morning, but I'm open to having this at a different time of day to ensure that all members can join for quorum. Is there a preference? How about the 27th at 1 o'clock? Would that be something that would be amenable to those on the board?
Seems reasonable.
Yes, Dominic. I see that your hand is raised, Dominic.
Yeah, definitely. I think that trying an afternoon one is great. I would just recommend, due to previous experience, not to do 1 o'clock, but to do 1:30 for a start time. And the reason for that is quite often people end up being late coming back from lunch, or issues occurring. And when historically we've started meetings at 1, it really means we're more at like 1:15. So I would just recommend maybe a 1:30 rather than 1 o'clock.
Okay, that sounds great. If that's been a previous experience, I motion to convene the next Medical Cannabis Advisory Board meeting on October 27 at 1:30. Is that amendable? Is there a second?
Second.
Second.
Eileen
Perfect.
seconds as
There's
well.
a- Excellent. All right. So our next meeting will be on October 27 at 1:30, and there will be a public posting 1 month prior to that. Is just before we close out anything, any other additional feedback from fellow board members? Or comments? Perfect. It's now 9:49 on April 21, 2025, and I motion that the meeting is adjourned. Is there a second?
Second.
Excellent. Thank you for the second. Thank you all very much for your time and participation, and we'll see you all on October 27 at 1:30. Thank you.
And Bettina, I'm
Thank you,
texting
everyone.
you.